2022 arrives with the shadow of the Omicron variant. The spread has been rapid, driving up COVID-19 infections to record-breaking numbers. The world is recording more than 1 million new daily COVID cases on average for the first time since the pandemic began. And the U.S. reported almost 500,000 cases yesterday, also an all-time high. Nikki Batiste reports on Omicron's impact and how hospitals around the country are now struggling.
It was yet another record-setting day here in New York. For the second straight day, the state set a new record of cases with nearly 75,000 new cases in one day. With it, hospitalizations have increased roughly 62% in the past week. It's playing out similarly across the country, with hospital systems beginning to feel the strain of surging numbers. More than 1,000 hospitals nationwide now say they have critical staffing shortages. It comes as pediatric hospitalizations have skyrocketed, increasing 58% according to the CDC. But as early as Monday, the FDA plans to make 12 to 15-year-olds eligible for booster shots, according to the New York Times. The new wave of infections continues to disrupt travel as well. Thursday, the CDC set their highest travel warning, saying people should avoid cruise ship travel regardless of vaccination status. More than 5,000 new COVID cases were reported on cruises in the last week, and many colleges, citing Omicron surges, have delayed return dates or moved classes online. Others have stepped up requirements for vaccines and boosters, and Princeton University has taken the unique step of banning students from any travel outside the university's vicinity until mid-February. Bradley?
Nikki, thank you. Let's bring in Dr. Bob Lahita now. He's a professor at the Hackensack Meridian School of Medicine and director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Dr. Lahita is also the author of the book Immunity Strong, which comes out next week. Dr. Lahita, thank you for being with us on this New Year's Eve. I spoke yesterday with Dr. Anthony Fauci here on CBSN, and I asked him why the CDC hasn't changed its definition of fully vaccinated to include a COVID-19 booster shot. Let's listen to what he said.
You know, the change of a definition is merely semantics. We're telling everybody, and I will state it very clearly now, that optimum protection is with a boost. So if you are not boosted, get boosted. What is called by definition for legal or other purposes a fully vaccinated person is in fact irrelevant. If you want to be fully protected, get boosted. I'm saying it very loud and very clear right now.
Dr. Lahita, we know words matter. What do you think about this on this guidance? Do you think it works in practice? And if he's saying so loudly and clearly, then why hasn't the definition been changed?
Well, it is true, Brad, that 33% of Americans have gotten the boost. Only 33% of Americans. Most Americans have gotten, about 62% have gotten the full vaccine, which is the 2 shots. So the boost was very, very important. And the boost, we know, cuts the infection with the Omicron variant by almost 40%. So it is really, really important. And those who have been boosted know that. And I just think that Dr. Fauci's definition is correct. I think it is irrelevant whether or not we call that a full vaccine or a partial vaccine. The most important thing is to get the vaccine, whether you've had 2 or the booster shot in addition. And, you know, some countries are talking about a 4th shot, Brad.
That's right. Israel is certainly looking at that, and discussions, Dr. Fauci acknowledged that that could be a possibility here as well down the road. Meanwhile, talking about boosters, the FDA could approve Pfizer's booster shot for 12 to 15-year-olds as soon as Monday. That's according to the New York Times. But based on what we know about how adults have reacted to the booster, Dr. Lahita, what do you think parents should know ahead of getting their teens vaccinated?
Well, I think children, as we know, do not suffer vastly from the Omicron variant, although many children, because of the sheer volume, about 1.8 million 12 to 15-year-olds have been infected with the virus up to date. And they're saying now that they can get the booster at 5 months after the second shot. These are the 12 to 15-year-olds. If I was a 12 to 15-year-old parent, I would certainly encourage my child to get the shot. The children who are dying in the hospital have comorbidities for sure, like obesity. They are infected with other viruses like the flu, respiratory syncytial virus, and they're really, really sick. So it is not very common that youngsters wind up with severe disease in the hospital. And that's good news for all intents and purposes.
Doctor, so much debate this week around the CDC's new isolation guidance. And in Michigan, the health department now says that the state won't follow their shortened guidance from the CDC for people who become infected with COVID. That's at least until Michigan can review their supporting data from the CDC and get other information. So do you agree with that decision? And do you think that other states should possibly follow suit and take things into their own hands?
No, I don't think states should take things into their own hands. I think it's a little bit controversial, but the whole point of this was based on data from epidemiologic studies, which show that you're most infected 1 to 2 days after you begin to have symptoms, and probably a day or so before the symptoms even begin, you're probably very infective. And then 5 days by that time, even if you're positive, what the CDC is saying, you should, stop. You should not quarantine, and you should wear a mask for an additional 5 days. Well, if the states are going to do what they want to do, it's a safety thing. So I understand their position. It's the Department of Health of Michigan. But, we have a loss of EMS workers, police officers, people in vital jobs like doctors and nurses. The numbers are dwindling, and that was the reason the CDC made that decision to go forward and cut the isolation time.
Right, all due to that Omicron surge. And in South Africa, where we first saw the surge, they have just lifted their COVID-19 curfew. They saw the wave first, but now the government says it's past the peak. And we've been a week or two behind South Africa. Are we likely to start seeing cases drop in a few weeks here like they are there right now?
I would hope so, Brad. I mean, that would be very, very good news. That's the Omicron variant. But remember, the Omicron is about 60% of infections. It's going through the country very, very rapidly. But we still have the Delta out there, which is very deadly, and it responds to the vaccine. So it is very important. I think that we will probably wind up flattening the curve here in about mid-January, I would hope. And I'm just hoping beyond hope. You want to see this infection go away because it is so rampant.
Doctor, as we prepare for the countdown, everybody's trying to make those last-minute judgment calls about how to celebrate. What would you recommend, and how are you ringing in the new year?
I'm bringing in the new year very quietly, Brad, just with my wife. I was planning to have a huge party, and I canceled that party about a week ago, mainly because I was worried about somebody being infected that we didn't know about. It's silly if you're having a party for 40 people to have everybody test positive or test negative, rather, before they come to your party. And that was a concern, and it's very impractical. I guess that's the term. So I think people should stay away from big crowds, just with family members that are protected, are vaccinated. Protect the children, protect the grandparents, be very careful. If somebody is unvaccinated, wear a mask, and make sure that everyone is without symptoms. That's probably the most important thing.
We have to stay flexible and adjust to the realities of the situation. Dr. Bob Lahita, we wish you a very happy and healthy new year. Thank you.
Happy New Year to you, Brad. Thank you.